Before the operation, the important point in hair transplantation is the basic meeting before the operation. The doctors must talk to the patients on the last 30-45 minutes to make them understand in detail what is going to happen. The patients are entered in a checkup to learn if there is a health problem or if he or she went to a dentist before and took any anesthetic to understand on allergic situations. We should hear if there is any reaction to the antibiotics or painkillers. After the analysis, we decide whether the patient is suitable for the operation or not. Then the hairline is determined specifically, but before this, we tell all the details about the surgery. Graft numbers are designated and predicted about the duration of the seance. The patient must be sure about everything from the beginning to the end. We absolutely tell the line of the hair to the patients in this meeting, because their desire is to close the openness on the forehead. The point of the design of the forehead line is how we have it, and it is the most important thing and it's the target. This is not so hard because this line appears by itself. There is a skin limit in the mobile area and in the immobile one. When they raise their eyebrows, this line is already from the hair because medically grafts need motionless place to grow up. The grafts are implemented and implanted in this motionless area. The second point is the non-mobile area. There is a mimic muscle under this area which we call the frontal muscle. These grafts which was implanted on the mimic muscle will contradiction in a short period. How we see this contradiction? There will be scars like orange peel, unnatural sightings. That is why we cannot transplant on this area. Otherwise, everywhere can be transplanted. I have to add this. The natural hairline is between in the mobile and immobile. Skin part when we move our eyebrows, after this line we determine the patient's openness. And how many grafts do we need and how long will take the operation? How will it look after the transplantation? Generally, patients wear a hat after the first day. On the third day, the washing will start and this will continue for a week. It takes 10 days. In the first month, there will be a shock hair loss. In the first 3 months, the hair will be grown. On the 7th and 8th months, the final look will be okay. It is to tell to the patients clearly. At the beginning, we should tell our patients how will they look approximately at the end. Because if there is no suitableness between what you can do and the expectation, even how you do your job very well, it is not enough. Even we implementation 5,000 grafts and make them to grow, we can make our patient happy. Be sure that you will be announced as an unsuccessful doctor. That is why the previous meeting before the operation is so vitally important.